Welcome, I'm Dr. Noah, your host of 21st Century Natural Health. What I'm going to be doing is giving you the cutting edge information of the last week in terms of health and wellness. So what I do is I review the scientific literature and review on the importance of good things that you need to do to be healthy and happy. So the first report we come out from is from the United States government that nursing homes are dumping grounds for mentally ill. So young and middle-aged mentally health issue type of problems, people on Medicare or Medicaid, are starting to be dumped in nursing homes, and that's starting to cause problems with the elderly and other factors. So this has been an increase of 41% from 2002 to 2008. So there's a real alarm in terms of what kind of quality care that both for the mentally ill and also for the elderly. Genes and cardiac health. This is from Nature's Genetics, March 2009. That gene variants, 14 common genetic variants, have a factor to play in cardiac health. I bring this to your point because there's lots of information out there from high-tech industry in terms of thinking that one gene, one problem, and as we're finding out with the cutting-edge type of science, is that genes are like a symphony. It takes a multitude of genes, and so having a magic bullet with drugs or in terms of genetic care is basically a pipe dream. This was interesting that with chronic kidney disease and high blood pressure, devastating type of problem. 13% of the population have chronic kidney disease, which equates to about 26 million, which is a rise of about 6 million since the 1990s, is that protein can be both good and bad for your kidneys when you have kidney problems. And what this study here in American Chemical Society, March 2009, showed is that protein from peas was able to help those people to have a 30% reduction in terms of low blood pressure and prevent kidney problems. Eating mushrooms and cutting breast cancer, something I talk about on my TV show, NapaValleyTV.org, channel 28, 21st Century Natural Health. Quite a bit is that eating these natural type of food high in nutrients and phytochemicals are able to have a very profound effect in terms of the devastating killers like heart disease, cancer, diabetes, osteoporosis. In this Australian study published in the National Journal of Cancer, March 2009, that eating mushrooms per day was able to reduce breast cancer by 65%. That's right, 65% just by eating mushrooms. Try to find some chemotherapy out there that does that kind of results. Probiotics, once again, a common type of theme on my TV show, is that helps with ulcers in terms of gastritis and stomach acid, which comprises about 25 million people. There's a little bug in there called H. pylori, and this probiotics was able to basically interfere with a protein called urases from attaching to the wall. American Chemical Society, March 2009. Fish is something that we've talked about, the omega-3 fatty acids. This one was from the Canadian Medical Association Journal, March 2009, showing us that the importance of that is because of the population that's starting to have an impact on the environment of fish, and that's really putting a real question both for myself and other type of people that are on the cutting edge of nutrition and good health about advocating a lot of fish oils in terms of helping that, which I still do some. What was interesting in this article that they started to talk about using algae and yeast and also becoming a vegetarian. So that's something I've talked about quite a bit in terms of helping people be able to have a better impact on the environment and not be so negative. Skipping breakfast, bad for health brains. This Australian study here showed that there a 42% decrease in terms of reduced learning, reduced attention, and poor food choices during the day. So breakfast is really critical, not only for ourselves, but in this study here had to do with children. Focus on treating malnutrition in cancer patients. European Society of Medical Oncology, March 2009. A common type of problems. 40% of cancer patients die of catacaxia, which is basically a malnourished type of state. So that is something that really has to be looked at in terms of people that are going with cancer to be able to help them get better and be able to be happy. Strong link between mothers' diets and health of their kids. University of Southampton, United Kingdom, showed that the link had to do with the parents, not the genetic factor. A common things I see in my practice is, my mother had it, my grandmother. Well, the reason is that because they had poor lifestyle choices, you watch that and you become too. And the Science Daily, March 2009, showed it has a lot to do in terms of basically mother's behavior and diet than versus genetic. Newer drugs are not always better, always a big factor about the scandals that are going on there, the high cost of new drugs. And what's really being discussed in the medical world is that a drug shouldn't be allowed to be on the market unless it's been shown to be better than the old drugs, which unfortunately they always compare it to a placebo, which sometimes they barely just beat that out. So that's what that showed. Breastfeeding reduces SIDS, very devastating type of disorder, sudden infant death syndrome, showing that breastfeeding, which is the only way to do, I advocate at least a year of breastfeeding, that 1 month of breastfeeding was able to reduce SIDS by 50%, and that was published in Pediatrics, March 2009. Omega-3 fatty acids do reduce triglycerides. In this medical journal, Current Opinion of Lipidology, March 2009, from Oxford University, showed that with 2.4 grams per day and within a 24-week period, 22% reduction in triglycerides. Triglycerides are a neutral fat, and they have to be also looked at in terms of overall cardiovascular workup. There's actually 14 different types of independent risk factors. It's not just cholesterol. The reason why cholesterol is focused because there's lots of drugs on that, and then the other ones they don't have. Low omega-3 fatty acids linked to depression during pregnancy, a big problem I see in my practice, that they're more likely to become depressed by 600% if you're low in omega-3. So that's something that really needs to be helpful. And as we've discussed in previous TV shows, is that the omega-3 fatty acids help the baby's brain system too, and that's in Psychiatric Research, March 2009. Low omega-3 fatty acids linked to depression, another type of different journal showing the same type of thing, is that eating seafood, which it has a kind of a double-edged sword because of the high pollution content while you're pregnant, was able to help with depression, and that was in Epidemiology, March 2009. Low zinc increased coronary heart disease in diabetics, University of Finland study, 8 years, which showed a almost 21% greater chance of having a heart attack if you are low in zinc. So that's something that's definitely necessary in terms of good diet and also nutritional supplements. That's in Diabetes Cares, March 2009. Here's the big one that was basically been discussed the last couple of days. Eating red meat boosts death rate. We talked about the increase in terms of heart disease and toxins and prostate cancer. Here, this very large study, 500,000 men and women, the National Institute of Health, the ARP Diet and Health Study, showed that over 10 years there was a 31% increase in death. So that's what you just take it home, and that was published in Archives of Internal Medicine, March 2008. Thanks for watching this show. We'll see you soon. Thanks.